Hi, I'm Gail Sansivero, and I'm a nurse practitioner in interventional radiology. I've been involved in vascular access for quite some time, placing both central venous catheters as well as PICCs. I'd like to tell you about a new innovation in catheter securement that you may have heard about, the SecurAcath. But before we get to that, let's talk about the way we secure catheters now. In the past, we always secured our catheters with sutures, and we continue to do so for many of our central venous catheters. However, there are many problems that come with suturing devices to the patient's skin. Typically, this is not the most comfortable option for our patients, particularly patients who are mobile. We can have skin irritation problems with sutures, and oftentimes they don't last. The sutures pop out of the skin and then the device needs to be resutured or it becomes dislodged. In addition, suturing a catheter exposes the clinician to the risk of a needle stick injury. That's something none of us want. So many years ago, adhesive securement devices were developed to secure devices. And this was a really nice innovation. It allowed us to stay away from breaking the patient's skin again and eliminated the risk of a needle stick injury. However, there are other problems with these devices. One is that they need to be changed regularly, once a week, sometimes more often in a diaphoretic patient. That's an expensive option for routine maintenance. In addition, in a diaphoretic patient, or in the case where a dressing gets wet, the adhesive device may not stick. So that's a real problem. Occasionally, patients develop an adhesive allergy reaction as well. So the SecurAcath device is an innovation that's available to you to secure both central venous catheters as well as PICCs. It's a novel device which has two small little anchors that sit underneath the skin. It's added onto the device at the time of insertion, so there's no additional item to purchase thereafter. It stays on the device for as long as the device is in place. We've placed this device for approximately a year and a half in our practice and have been very pleased with the results. In addition, we've been surprised at how comfortable it is for patients. We really haven't had complaints from our patients, even in the most emaciated patient or the patient with the poorest skin turgor. From a clinician perspective, I really enjoy the securement that this device provides. When we change a dressing, we don't have to worry about our line being secured. If the patient moves during the dressing change, for instance, during the change of an adhesive device, the device is in place, and even if the patient moves, the line's not going to come out. From the perspective of performing the dressing change, it's very easy to perform skin preparation, add any antibiotic-type devices on top, and add your dressing. And because there's no additional adhesive device to add on, the dressing change actually occurs faster. So I really encourage you to look at this innovation in vascular access practice. It's been a great system for our patients who have really been very, very happy with it and have accepted it very well. In addition, from a nursing education perspective, our nursing staff has accepted it very well, and the learning curve has been very quick and easy, much more so than I expected. It's an easy device to use.